Muscle contraction is really an amazing event. We'll check that out in a minute. Let's first of all get some vocabulary worked out. Skeletal muscles contain bundles of muscle cells, and each muscle cell has thread-like myofibrils. Take a look at the diagram lower right. Get an idea. There's a bundle of muscle cells, muscle cell, and inside are the fibrils. Each of these fibrils is divided into bands. The dark bands are called Z-bands, and they're going to mark the end of each sarcomere. Now, I'm going to use these words frequently, so let's get some of this squared away. The sarcomere is a unit of muscle contraction. Take a look here under the microscope. This is what you see. You see dark bands that border a sarcomere. The sarcomere contains two kinds of muscle cells, actin and myosin, and they each have a specific role. Let's look at actin first. It's a globular protein, and its job is to slide back and forth. You see, muscles don't really stretch, and they don't shrink. They slide. Actin also has a troponin protein that is going to block a binding site on actin. Now, right now, this might be a lot of vocabulary, so just understand that the first time through might be confusing. It takes a while. I said there are two types of muscle fibers, the actin and the second one is myosin. Now myosin is really distinctive. It has a double head that sticks away from the sarcomere center. And the purpose of that head is to fit into the binding site on actin. When that happens, we have what's called a cross bridge. Now actin and myosin are anchored to the Z-bands, and I'll tell you why. If they're not anchored to a Z-band, they can't slide. They'll go sideways, or they'll get jammed up. So we want this smooth parallel action, and that's what the Z-bands help to anchor. I made a diagram here, and you might do this yourself on a piece of paper. I just sketched out I used a computer to diagram a myosin with a head, and an actin with a little binding site. Let's move on to the actual contraction of a muscle. It begins from the nervous system when an electrical impulse travels down the spinal cord to a motor neuron. Motor neuron is attached to the muscle cells. Once the impulse reaches the muscle, it's going to stimulate what's called the sarcoplasmic reticulum, or SR. And this is just a unit that surrounds a muscle fiber. The job of the sarcoplasmic reticulum is to release calcium into the actin filament of the myofibril. And I'll tell you why in a minute. You see, calcium is going to bind to the troponin protein on the actin filament. Now don't let me lose you. Take a look at the diagram below. There's actin, there's myosin, there's the binding site. Now if you look at the diagram to the right, this is like an end view. What calcium does is it's going to cause the troponin to shift. It's going to shift sideways. Take a look at the top, then the middle, and then the bottom view. It's going to shift it, so now troponin is no longer covering the binding site. The binding site is open and available. That's the job of calcium. Myosin senses, hey, that binding site is available. I'm going to bind to it and form a cross bridge. Now the two muscles are connected. We start to slide. Now that we have a cross bridge, the myosin head, take a look at the diagram, the one I made, the simple one. Simple can be good. The myosin head is going to tilt, and when it tilts to the right, it's going to move the actin filament. So actin has action. Sometimes I I say that to myself. Actin is the one that's going to slide because the myosin's going to pull it along. Myosin is going to stay in place. Its job is to use these short power strokes to slide the actin filament together. And this is how muscles shorten. This is how they contract. Now we had calcium. The other big player in this contraction is called ATP. It is a energy packet that is going to drive this contraction. The sarcomere stores phosphate in a chemical called creatine phosphate. And it's an extra source of phosphate. And I'll tell you why. It's because when we contract a muscle, we use some energy, and ATP is going to lose a phosphate bond. And when it does so, it becomes ADP. It's kind of useless. ADP, the body doesn't have much use for. And so it would be worthless except for the sarcomere pops another phosphate on there. Now we have a high energy ATP, and we can contract that muscle a little bit more. Some athletes take creatine phosphate when they work out, but our body produces a lot of it, most of what we need. As new ATP is released in the muscle, the ATP is going to bind to the binding site, causing myosin to release its grip. Okay, take a look at the diagram again. Remember when calcium came in there and troponin slid out of the way, we had a cross bridge? Well, now the cross bridge is over with. ATP is going to block that site, and so no more sliding occurs. There are situations such as rigor mortis, or stiffness of death. This is going to happen when the body dies and ATP is not being released into the muscle tissue. Without ATP, the myosin cross bridge does not break. This is one way forensics can determine time of death by degree of rigor mortis. This binding action may last 24 to 60 hours after death, depending on lots of factors. Temperature of the body and the environment, other chemicals involved, and so forth. A muscle twitch, you've probably felt a muscle twitch before. That is when a motor neuron, we're talking nervous system here, sends an electric impulse into the muscle fiber, and all the cells in the fiber contract. Muscles either contract or don't contract. They don't have a in-between. It's called all or nothing. When you have a sustained twitch, that's called tetanus. That's a little different than the disease in this case. A tetanus is a powerful contraction, generates enormous potential. When we have an isotonic contraction, that's what I've been describing. That's when we have a sliding filament, a shortening of the sarcomeres. If the workload exceeds the muscle's peak capacity or the ability to move it, like let's say you're trying to push on a wall, that wall's not going to move, your muscle's not going to shorten, it's going to be in what's called an isometric contraction. Calcium's released, the muscle's preparing to do work, but the sarcomeres do not shorten. So for muscle building, generally isotonic gives a better benefit. The review here I set up, let's look at, we have actin. Remember, actin has action, it's going to move. Myosin has the heads. Get the vocabulary straight. Calcium is going to enter the area, it's going to allow the cross bridge to form. Myosin is going to tilt, moving the actin inwards. The result is shortening the muscles. It's kind of weird to think that muscles don't stretch or contract, but they slide. Myosin head drags the actin filaments inwards, pulling the Z-bands closer together so that muscle is gradually shortening. Finally, ATP is going to bind to myosin, and that cross bridge is broken. We're going to learn a little more about muscles by studying disorders. The first being muscular dystrophy. This generally is the result of a missing or dysfunctional gene, but sometimes a virus or an infection or something else may cause it. What happens is the sarcomeres are not contracting properly. And if you remember, the sarcomeres are those units of contraction that are bordered by Z-band. Over time, those muscle fibers are going to break down because there's a chemical imbalance, sometimes too much calcium or there's other situations that cause the body to gradually digest those muscles. A sprain is different than a strain. Look at the P, sprain. This is due to a damaged ligament, and ligaments connect bones to bones. Typically, we have sprains occurring when a joint moves outside of its normal range of motion. Okay, so on a day-to-day movement, the ligament's fine, but then when we do something really dramatic, like make a fast cut or a turn while we're running, suddenly we have a sprain. There's two very common ones when people turn their ankles. Let's say they're running and they step on something, or whatever happens, their foot turns outwards. Then it's often the calcaneal fibular, if you look, that is on the lateral side of the foot, or the talofibular. Think of the talus bone of the foot. Those are the two that are likely to undergo a sprain. And a cold pack and taping that athletic tape will sometimes help. Shin splints, I like the technical name, medial tibial stress syndrome, because what is a shin splint? I know what a tibial stress syndrome is, and that's where we have fatigue or trauma to the muscle tendons that attach to the two major bones of the lower leg, the tibia, which is larger, and the fibula, the smaller bone, which tends to be in the back. Over time, these tendons may pull away from the bone, or in some cases they'll pull away a piece of bone with them. So this is a syndrome that can be mild or can be fairly severe and debilitating. Loose bodies. Boy, a lot of people have had surgery when they just have something simple like loose bodies. Let's look at this joint. Let's say the anterior cruciate ligament in the knee, or the meniscus, which is kind of a cap covering the ends of the bones. Let's say there's an injury there, and there's a tear in that cartilage. Well, these pieces of cartilage are going to float about in the knee joint and cause problems. Sort of like if you have a door and you stick a pencil in there and try to close the door, it's not going to work. We tend to find loose bodies in synovial joints. So those are the large joints of the body, like the knee, the hip, the shoulder. Sometimes a simple debridement, flushing with saline, arthroscopically can take care of this very painful disorder. The cure can be simple. Tenosynovitis, itis. We know there's inflammation going on here. The synovium membrane is what forms a sheath around tendons, and it's a marvelous design when it works. But occasionally, due to injury or overuse, infection, the synovium becomes inflamed, and when it's inflamed, it's going to swell. And as it swells, it's going to interfere with the sliding of the tendon, and so you're going to have reduced mobility. And it's also going to press on nearby nerves, causing pain. So reduced movement and pain. Again, sometimes a cold pack, if it's a mild inflammation, will take care of it. Meniscus tears. These are so very common. They result often from twisting and pressure. One of the common ones is a guy is carrying something, a load. Well, I shouldn't say a guy or girl, and someone says, "Hey," and they turn around and they twist on that knee while they're carrying something, and there goes the tear. It's a crescent-shaped, or I like to say horseshoe shape, and it's on the ends of the bones. It's like a cap of the femur, which is the upper leg bone, and the tibia, which is the lower or inferior bone. The immediate results of this are swelling and pain. And there is a lateral, which is on the outside, and a medial, which is on near the midline. Either one of those can tear. This takes sometimes time to repair, or a surgeon needs to go in there and sew it down or trim it. It's not often a serious disorder. If well, it depends on if there's arthritis. It can be complicated. Achilles tendinitis. Tendinitis affects lots of joints in the body. What we have is inflammation of a tendon, and in this case, it's the calcaneal or Achilles. If you remember, the old name is Achilles, the new name is calcaneal. I kind of like them both. Achilles has a historical name, the Greek mythology, but the calcaneal I like also because it attaches to the calcaneus, so it kind of helps us. The calcaneus is the heel bone. The calcaneal attaches to the gastrocnemius, which is our large calf muscle. If this tendon is inflamed over time, it's going to be pocketed with scar tissue. It becomes roughened and less flexible as the scar tissue replaces the healthy tendon cartilage. So it's something to pay attention to. We don't want to ignore those little pains in our body as we age. We want to address them. Strains are going to be different than sprains because here we have a muscle fiber, not a ligament. So the muscle fiber is going to tear or rupture, and this is going to cause the sarcomeres to contract, which means the muscle is going to go into a spasm. Most people call this a cramp. Very painful. Blood's released, and we may have some internal bruising, swelling. Sometimes the tissue looks kind of dark. One common example is the groin strain. Let's say you're sort of haven't warmed up properly, and suddenly you dash off somewhere and make a quick turn. Oh, the adductor longus muscle suddenly has a tear in it. This is the muscle that brings the thigh inward towards the midline. Adduct means to bring towards. Groin strain. So watch out for this one. Bursitis, a lot of people don't even know they have bursa. These are little sac-like membranes, little tiny pillows in the joints that cushion the space between bone and fibrous tissues of muscles and tendons. They may become inflamed or they may burst, but most of the time they behave. They don't give us much trouble. One example is the tendocalcaneal bursa. This is at the base of the Achilles. And this is the cause for sharp pains right in the heel. Tendinitis is different. Tendinitis tends to extend up into the calf a little bit, whereas bursitis, this type of bursitis, is going to be a sharp pain right in that calcaneal area. Plantar fasciitis. Many people suffer from this sometime in their life. It's a dense sheet of connective tissue, the plantar fascia, and it's going to support the arch of the foot. And most of the time, not a problem, but when it becomes inflamed, it's usually due to overuse, or sometimes there's micro tears in that sheath that surrounds the fascia. The cause is variable. Sometimes if the gastrocnemius, the calf muscle, or the calcaneal tendon are really tight, which tends to happen as we age and our pelvis kind of shifts a little bit, we start to slouch a little, and those tissues shorten, they're going to cause a repetitive overstretching of the plantar fascia. And we're not even aware this is happening until suddenly we have this pain. Other factors can cause it as well. Distance runners get it. And the treatments are variable as well. Some people freeze golf balls and roll their foot on it, but I certainly don't recommend it. There's many other treatments that have a lot of success. Iliotibial band or IT band syndrome. This happens when there's an inflammation of the dense fascia that extends down the thigh. It attaches at the iliac crest, which is the lateral edge of the pelvis, and then it inserts into the tibia, which is the larger bone in the lower leg. This band, along with the gluteus maximus, minimus, and the tensor fasciae latae, their job is to stabilize the knee during running. And here's another example. When we age, if we're not maintaining flexibility, then the IT band is likely to cause a lot of grief. So we can't afford to be inflexible, even as a young person. Stretching, warming up, moving the body, fine-tuning it, all will pay off. Here's our review. Muscular dystrophy, often a genetic disorder where the sarcomeres are gradually dysfunctional. Sprain, there's the P. Ligaments, this is where bone-to-bone connections moves out of range. We tend to have the calcaneal fibular or the talofibular, and those are on the lateral side of the foot. Medial stress, tibial stress, sometimes called shin splints. That's when there's a fatigue or trauma to the tendons that attach to the tibia or the fibula. They're going to pull away. Loose bodies are just what the name suggests. They're loose pieces of cartilage that are torn from the cruciate or from the meniscus, and they're going to float around in that cavity and cause pain. Tena synovitis is an inflammation of that synovium. It's a sheath that surrounds the tendon, and it swells, causes pain, and reduces mobility. Meniscus, those are the horseshoe-shaped pads or caps of cartilage on the end of the femur and the tibia that cause swelling and pain, usually easy to repair in a young person. Achilles tendonitis, inflammation of that calcaneal or Achilles tendon that attaches to the gastrocnemius. Strains, there are many types of strains. I mentioned the sarcomere shortening, a spasm in the adductor longus, the groin muscle. Bursitis, those are those little pillows of pads that are in many of the joints, and they could become inflamed or even rupture. One I mentioned was a tendocalcaneal, sharp pain in the heel. Plantar fasciitis, that is micro tears or some inflammation in the fascia, in the sole of the foot, often due to a tight gastrocnemius or calcaneal tendon. And finally, the IT band, which gives us reason to stretch and remain flexible until the day we die. The gluteus minimus maximus, the tensor fascia, and the IT band together stabilize that knee when we run. Wow. Some vocabulary here. Let's make sure we know what a myofibril is. The sarcomere, of course, the unit of contraction, and the Z-bands are the borders of the contraction unit. Sarcomere is, of course, made of actin, the action filament that slides, and the myosin has the head. Creatine phosphate, do you remember that? Big word, but simple job, to provide phosphate so that ATP can be made. Actin, troponin has that binding site, and it's going to slide away when, guess what? Calcium. Calcium's going to cause that binding site to open up so that myosin can jump in there, form a cross bridge. And let's think about the goal here. The goal is to shorten the muscle. Sarcoplasmic reticulum, that is going to be stimulated by a motor neuron and release calcium. ATP contracts the sarcomere, and so on. Rigor mortis, that is when we have no ATP available, and so that cross bridge between action and myosin is going to stay in place for many hours. Muscle twitch is when the motor neuron stimulates a muscle to stay contracted. Isotonic is when we contract and shorten a muscle. Isometric, that's when you're pushing on that wall and that wall is not moving and the arm is not bending. Wow, this is some amazing stuff.